it just doesn't work. You put people on the medications, and then 6 months later, you have to bump the dose. And then, within 2 to 3 years, the person is maxed out on the drug. And I was seeing just classical tolerance going on that you would see with, alcohol or, opiates or anything like that, where the brain just kind of adapts to it. I mean, we have a finely tuned physiology. Our neurotransmitters are involved in how the body functions, the way our heart beats and the way our digestive system works and all of that. And when we disrupt these systems with drugs, it fights against that, and we downregulate receptors and we produce less serotonin and things like that. And I was just seeing that real time. And so I wouldn't see like, hey, take the 50 of Zoloft or the 5 of Lexapro or whatever other SSRI you're on, and the person just kind of sailed off into the distance and they lived a happy life,
Like the commercials, yeah.
No, not at all. And so they would just be back, and eventually they're maxed out on the drug, and they would say 2 things. They would say, I don't even know what it's doing, was really common. Or they would start to say things like, it's just hardly having an effect. And typically at that time, the person, they just stay on the medication and it's not really that helpful and their life is not going that great. Or we start to stack drugs on them. And then we, more and more and more. And so I would start saying things to my attendings. I'm just like, well, this doesn't really seem like a good long-term solution. The drugs are wearing off. The patient's not getting better. And they would say, well, Joseph, there's this thing called treatment-resistant depression, or, maybe they have like an adverse reaction and they start looking a bit manic. They'll say, well, actually, that it was depression originally, but it was actually just undiagnosed bipolar disorder. So they would just start like making up these reasons why the patients weren't getting better, essentially, and all roads lead to blaming it on the person's brain. And then, obviously they would have like another drug for that.